is Jackie Hansen, and this is a PowerPoint presentation on carotid stents. So the patient was brought in with symptoms of difficulty of walking and numbness on one side of his body. He did have a previous heart attack 5 years ago, and he was told that he had a stroke, but it wasn't happening currently, and he didn't know when it had occurred. But his lab values came back normal, and in an assessment from his doctor, he heard a bruit in his carotid arteries. A bruit is defined as an abnormal sound. It can also be described as a sloshing sound. So the doctor ordered a carotid ultrasound, and we'll be able to look at those images a little later on, but it was found that he had a 70% stenosis on the left and a 50% on the right. So in order to talk about carotid stents, we have to talk about why we would use a carotid stent. So that brings us to atherosclerosis, which is the hardening of the arteries by the accumulation of fatty substances, extracellular matrix, and inflammatory cells. Once the atherosclerotic disease has progressed far enough, the term stenosis is used, and that usually occurs when the diameter has decreased by 50%. So according to his ultrasound, you would say that his vessels were stenosed. Typical risk factors associated with this disease are smoking, hypertension, diabetes, obesity, renal failure, and physical inactivity. Without any treatment, complete occlusion may occur, and the possibility of a stroke also increases without treatment. So treatments for atherosclerosis or stenosis of the carotid artery would be a carotid endarterectomy and a carotid stent. So carotid endarterectomy is a surgical procedure where the plaque is removed, and there are 3 main types, which is primary suture, patch suture, and aversion technique. And this is a real surgical procedure where the patient would be put to sleep, and a whole procedure would go on. Whereas a carotid stent is a non-surgical treatment where a tube is placed within the lumen of the vessel to create a wider opening, thus allowing greater flow through the vessel and getting rid of that stenosis. So this is just a slide describing the procedure of a carotid stent just in more detail. Again, it's a non-surgical treatment where a thin hollow tube called a sheath is inserted into the blood vessel in usually the leg or the arm. After the sheath is placed, a long narrow tube called a catheter is inserted through the sheath and is guided through the aorta to the carotid artery, and it's aided by an x-ray machine so they know where they're at and where to go. Once in the carotid artery, a guide wire with a filter is placed above the stenosis. This is used to catch any loose debris that may have been knocked from the procedure. And this is just a safety thing to make sure that it doesn't travel into the brain from the procedure. So after the filter is placed, a small balloon mechanism is then utilized to compress the plaque and widen the lumen of the vessel before the actual stent can be placed. This just allows that just more room for the stent, and then the stent is used to strengthen the vessel and to keep its shape so that it doesn't collapse back down or create more stenosis. And this is an effective treatment in widening the vessel, but it isn't a cure because there can always be more plaque if the patient doesn't change their lifestyle. So it's an easy treatment that can help in the meantime, but the only way to cure it is to quit smoking, eating right, and exercising daily. Some plaque is common in most everyone with increased age, but the severity is due to the individual's lifestyle. So after the patient had their carotid ultrasound, the doctor ordered a CT angio of the head and neck to confirm the diagnosis of carotid artery disease. And for this patient, after the angio, they were advised to change their lifestyle, and they scheduled an angioplasty with carotid stent placement. The procedure went without any major complications, and after the procedure, patients are always instructed to lay flat for about 6 hours. This just helps to decrease the chances of blood loss from where they entered the teeth. And then they usually will order a carotid ultrasound to assess the procedure, make sure that everything is flowing normally, and that the procedure was a success. After the patient is discharged, they are prescribed aspirin and Plavix to take for about 1 month after the procedure to decrease the chance of a blood clot. So here are some images on this patient. You can see the hypoechoic lumen and then that bright hyperechoic plaque proximal common carotid into the mid-common carotid. And this is almost the same view, just a little further up the common carotid artery. But you can really see the severity of the stenosis in this vessel where there's not a lot of room traveling through that area. It also has a lot of shadowing. Here is a picture of his bulb and his ICA, and in this image you can really tell how much plaque there is in the bulb where you really can't see much of anything diagnostically other than you can see the plaque on that anterior edge. This next image is of post-procedural carotid stent. It's a textbook image of the hyperechoic with those with the little lines through it, and you can see the plaque behind it and around the edge of the lumen, and where the balloon had compressed the plaque down and widened the vessel, and then the stent was placed and it's open and flowing, and that's it. Thanks for watching.